This is the FM Gold channel of All India Radio. In the program Spotlight, now we bring you a discussion on preventive measures against COVID-19. The participants are Dr. Naresh Gupta from Lok Nayak Hospital and Chetan Chauhan, journalist.
Dr. Gupta, how has the government been able to check the spread of coronavirus and what all steps they have taken?
See, so good to see this time that the government and the political will has come on a war footing against the corona invasion. And whatever steps they have taken, including the testing of facilities that are being augmented, they are all being done in anticipation. So once it was seen that coronavirus could become an epidemic and now pandemic, they have been taking all the measures in a stepwise manner. We had the technology. The question was of implementation, and that's where they came in. So all the checks that were put on the flights, particularly from those countries where the outbreaks has been very severe, was to contain those cases that could come and bring the virus into the communities where it could spread. And you can see that this has been augmented based on what is there elsewhere. And it is an accepted fact, even WHO will accept it, that this kind of a measure should be done in the beginning, before there is a big outbreak. Once there is an outbreak, it doesn't serve so much purpose. So they've been doing it. Now the feeling was that once you restrict it, then maybe if the spread has to occur, it will slow down. And the chances, there is a possibility that the demand for testing might go up in near future, in the coming weeks. Keeping that in mind, I think the ministry has taken a stand that we are augmenting the facilities in our own government setups, but the private may also be engaged in, provided they are capable of doing it and they are conforming to the stringent standards that are required for corona testing. So they are taking good measures, and one of the very good measures that they have come in with is the public awareness program. You see the newspapers, you see the media, you see the TV, you see the radio, you have all these social media, everywhere it is talked about. And the best thing about these preventive measures, whether it is the preventive measures in terms of the respiratory etiquettes, cough etiquettes, what we call, or the droplet infection that tends to spread like the flu, like a common flu, it spreads like that. So you don't sneeze on somebody's face, you don't cough, you don't spit anywhere, you don't cough out anywhere. Now coughing and spitting is such a national kind of a habit. If it goes away, it will save us not only from coronavirus infections, but dozens of other infections that are so debilitating that they lead to loss of man days in our own society and all over the world. And the other measure of bringing in hygiene is just an extension of Swachh Bharat Abhiyan. I call it Bhu Swachh Abhiyan. You clean up your body externally. So all these viruses, they might be there in the environment for short times, but bringing in good habits will bring collateral benefits which will be much larger than the benefits in terms of corona alone.
Dr. Gupta, to our listeners that as of now India is at stage 2 because the number of cases reported is more than 100. We are very far away from stage 3 where the local contact spread is very high, like it happened in China, it happened in Iran, it happened in Italy, where within a few days, 15 to 20 days, there was a huge spread among the local population and large number of deaths were reported. So far, even though if we see in Rajasthan, even in Kerala, even in Maharashtra, even in other parts, this local spread has not happened. I will like to tell the listeners, like in Rajasthan, the Italian tourists visited 6 districts and they came in contact with about 215 people. Not even a single person with whom the exposure level was not very high was not test positive. The only person, Indian, who tested positive was the driver because the exposure was very high. And if we see the number of cases of the Indians which have spread through local contact, the 3 Italians, the 3 guys who came to Kerala from Italy, they did not report at the airport. They went out and they spread in the family. Similarly, in cases in Agra also, the people came from Europe, didn't inform the authorities and the spread happened. So in this, I think the people should do a proactive disclosure at the airports, at the government hospitals. What will be your advice, Dr. Gupta, on proactive disclosure? There should not be any shame or anything associated with it that, oh, there is a guy who is suffering in this house from coronavirus, or there is symptoms of coronavirus. And the possibility of ostracization should also not be there.
Yes, Chetan, you have said it very right. And I think there is no question of any shame for getting into good habits. One thing that the government and wants from the society and a common citizen is that they must understand the primary philosophy for all these measures. The primary philosophy is, if somebody has got a disease or a potential of a disease, he or she should not spread it to others. The moment it gets into the mind and heart of the common man, they would take all these measures. They would not want to cough into somebody's face. They would not want to spit. They would use a hanky or a mask or whatever is required. Remember, all these measures like masks and things like that, they are required more by persons who are suffering from flu-like conditions. Don't think that these masks are required only if there is a risk of coronavirus. Even if it is common cold, which we get during change of season, the same masks would prevent its spread to those who are not having the disease. So I think the primary philosophy behind this must be understood, that the primary reason why we want all these measures is that a person who is suffering from it should not give it to others. That person may be having fever, they may be having cough, they may be having bad throat, whatever is there, running nose, but they should not give it to others. Whether it is corona or no corona is not the matter. The other thing, there is a research that has just come in which says that all persons who get coronavirus or other viruses do not have the equal degree of symptoms. Some become so sick, very small percentage, and majority of them are actually asymptomatic. They have no symptoms. Now those who have no symptoms can also spread the virus, which means if I am exposed to somebody in my family who is running a viral or a coronavirus or other virus symptoms, I also carry a risk of spreading it. So I should refrain from going into areas where I can spread it more. So I think that is the philosophy that one should keep in mind. As for the spread, the same virus you would see globally is not spreading in the same manner. Some places it has created more havoc, some places it has created. It's a new mutation of a virus. We don't understand it so well. So we don't know. The risk would remain. We must be prepared.
Whether it is the reason because it has spread mostly in the places which are slightly more colder than the rest of the world, maybe the tropical countries, like if you see the Europe, most of the European countries, Italy, France, Germany, from where the most cases, US also, the conditions are said to be more conducive for spread of and survival of the virus, unlike the tropical countries where, because of the increasing temperatures, the virus may not spread so fast or may die. So I wanted to know whether it's a myth that if the temperature rises, the virus spread will be less.
See, let me put it like that. There is no scientific work, study or research to say that that is the truth. Right? It is anybody's guess. Now, it is something that can spread like wildfire. That once the temperatures rise, then we will all not have this. But once we think of Europe, where it is likely to be cold at this time, we don't forget the Southeast Asia. You look at Thailand, you look at Singapore. They were celebrating their warmth coming into the climate when they got attacked by it. And even in China, which probably had a cold weather when they got it in December, they also had regression of the disease when it still was not warm enough. So that is a kind of something that cannot be substantiated by medical research. And remember, our body carries a temperature of 37 degrees, which is pretty warm, and the virus loves to thrive in there whenever it gets a chance. So I think this is more of a myth, as you'll call it, rather than a scientific evidence.
Large number of people also believe that the coronavirus spread may happen because of social contact. A large number of governments in India have shut schools. They have also said that you can work from home. The biometric systems in the government have been stopped for the time being. A large number of other restrictions have also been invoked. The government of India has invoked the Epidemic Act 1897 to enforce the measures which are needed to prevent the spread of coronavirus. But the one question which many people ask, if it spreads, so are the state governments equipped to deal with widespread in a country which have 1.3 billion population?
You see, as I said, the government is preparing itself and they are acting in anticipation as to what can happen. The number of facilities that are created, the number of quarantine places that have been created, everybody, army is helping, police is helping, private institutions, everybody is helping. And now the diagnostics also is being expanded. We don't know what eventual outcome would be of this pandemic. It might settle down quietly because the measures that have been taken are so effective and stringent, or it might break through and spread like wildfire. Whatever it comes, in anticipation, whatever human mind and the resources permit, those measures have been taken. So I think we should not worry that it is 1.3 billion and what will happen. Let us hope that we will be able to contain the coronavirus. Remember, despite all this, we have only 140 cases, which is not a large number. Look at our population. So it's possible that we are able to hit the virus, contain it much more effectively. Some because of our doing, some because of whatever citizens doing, community doing, or our environment. But let's pray that we are able to contain it, and we should not be worried on that front.
Dr. Gupta, there have also been cases where the people have been put in isolation. They ran away from there, took a train.
That's why the Epidemic Act came in.
Yeah.
There's no need otherwise. I mean, you have to bring some kind of a force onto the citizens that you don't think of yourself, you think of others. And it is a disease where one doesn't to think of oneself, one has to think of the rest of the society. And that's why the Epidemic Act, because epidemic refers to the risk of spread to the rest of the society, community, and the nation, and the globe.
What are the first symptoms for people to go for the test, because the facilities have expanded? What are the first symptoms?
See, the first symptoms remain the same: fever, cough, bad throats, breathlessness. But the first thing is, if you have come in contact with somebody who has been to a corona-affected area, then you should go in and the test will be done free.
With this, we thank all of you. Thanks a lot.
You were listening to a discussion on preventive measures against COVID-19. The participants were Dr. Naresh Gupta from Lok Nayak Hospital and Chetan Chauhan, journalist. This program was produced and presented by the News Services Division of All India Radio. This program is also available on our website, newsonair.com. You can also follow us on the News on AIR app for updates. You may email opinion about this program at airnsdtalks@gmail.com.